Welcome to a very special episode of RPEC on Air, the official podcast of the Retired Public Employees Council of Washington. My name is Alyssa Brady. I'm the project coordinator, and I will be your host. Now, we all know how confusing and overly complicated our healthcare system can be. So that's why RPEC has worked to create and compile healthcare resources to help members make informed decisions. This started as a multi-part webinar series and a unique one-stop webpage on the RPEC website dedicated to open enrollment. And last year, we expanded our resources to include episodes of this very podcast, and we're back in video format. We have two special guests joining us today to talk about navigating open enrollment. And so I'd like to welcome back RPEC's Healthcare Workgroup Chair and Chapter 3 President, Matt Groshong. Hi, Matt. Thanks for joining us. We also have Tim Smolen, the Program Manager of the Statewide Health Insurance Benefits Advisors, otherwise known as SHIBA. Hi, guys. Welcome back. Thanks for joining me.
Nice to see you. Hi, Matt.
Good
nice
to see
you.
Right, so we've got a presentation we're gonna show, and I'm gonna put that up right now. And you guys can just take it away.
Welcome, RPEC members with Medicare. This webinar is designed to stress the importance of reviewing your medical coverage annually for your plan's open enrollment period. Why? Plans change every year, just like everything else. Your drugs, pharmacy, and even your doctor might no longer be covered. This unfortunately happens to millions of retirees every year, and we don't want it to happen to you. We will show you the steps to make sure your 2026 medical coverage fits your needs and there are no unwelcome surprises. I also want to stress how hard RPEC works for you and how your dues have funded major health insurance successes. 1, our group efforts saved the PEB-UMP Classic Medicare plan from closure. 2, we successfully lobbied the legislature to require HCA to work to identify a more affordable UMP Classic Medicare plan that would not compromise quality. 3, RPEC worked alongside HCA to develop and implement the current UMP Classic Medicare Part D plan, which saves members thousands of dollars in premiums. And those premiums are dropping again for 2026. 4, through our work, HCA has increased the number of in-person benefits fairs and is continuously making improvements to the open enrollment process. And finally, we're continuously developing information that also applies to the many RPEC members who do not get their insurance through PEB, such as this very webinar. And so with that, I'd like to hand it over to Tim Smolen, a tremendous friend of RPEC and I would say a walking encyclopedia on the complexities of the Medicare health insurance market. So thanks, Tim.
Oh, Matt, that's an overgenerous welcome. Thank you. I am a big fan of RPEC and love working with you and Alyssa and Lori, Derek. You guys have been great. And so very excited to come back again. You know, as you said, open enrollment is kind of peak workload and peak stress for Medicare beneficiaries. And, you know, I think if there's one goal about the programs that you and I have worked on together, it's just to get people to kind of not bury their head in the sand, right? But you know, kind of get off the sidelines. And even though it can be sort of challenging and feel overwhelming, we really want people to engage with open enrollment because, you know, we want them to get the best value they can. And these decisions affect your access and your health care. So we really want to make it feel to people like it's worth spending a little bit of time and to reassure them that through RPEC and through the SHIBA program, there is support. They're not in it alone. So this is my personal contact information. I am a state employed person. I work for the State Office of Insurance Commissioner. Washington is one of a small number of states that elects our insurance commissioner. And so we have a new commissioner for starting in January. Her name is Patty Kuderer, and she is a big supporter of the SHIBA program. And so we're very grateful for her leadership. And this is how you can contact me, and I would absolutely welcome your call or email if there's anything at all that I can help with. Here's a preview then. My friend Leanne Prelip from the WEAR, which is another great supporter, likes the the model about tell them what you're going to tell them what you told them. So here comes that model then for today. Here's your preview. We're going to introduce something new for us this year. We have created what we call the Medicare Open Enrollment Period Jumpstart Toolkit. And then we're going to highlight 3 scenarios that likely apply to most RPEC members. As Matt said, we're very aware that many people who are members of RPEC are not enrolled through the Healthcare Authority PEB program. So we're going to talk specifically about those folks that get their insurance in the commercial market. Then we'll talk about changing plans or switching from one system of care to another. And what I'm talking about here is original Medicare compared to Medicare Advantage. I want to take a moment to explain about the Medicare Savings Program, which is an opportunity for people who have Medicare to have the state pay their Part B premium, so it's not deducted from your Social Security check. And then, of course, this is a volunteer-driven program. Volunteers are the heart and soul of the SHIBA program, and I know that RPEC relies heavily on volunteers, so Matt and I each are going to respectively make our pitch for you to join as a volunteer.
I'll do that right now.
Hey,
Right.
Go for it.
SHIBA is an amazing program because volunteers are trained to assist retirees with wading through the complexities of our healthcare insurance system in the United States. And there are situations where people really need help, and the insurance company can't help you with it. The Medicare website might not be working for you, or you might not be as familiar with technology. And trained SHIBA volunteers, highly trained SHIBA volunteers, will help you get what you need in the health insurance system. I just went through the training myself. I hope to take the next step soon. And I invite you also to check out the being a SHIBA volunteer.
Well, thank you for that, Matt. I appreciate that. On the screen, we have then just a visual of what the Jumpstart Toolkit looks like. For those of you who are the same generation as me, we call this a peachy. So it's one of those paper folders with an inside left and right pocket, and then we have these inserts that go in there, so you're getting kind of a visual display of the individual items that are in the toolkit there.
Is this a good time for me to open mine? I just got mine in the mail.
This
Can
is
I
a
open
great.
it? Okay.
I wish
I'm
you
gonna.
would. You can follow along. There's Matt has
Whoops!
his
I wanted
phone.
to. Here we
Oh,
go.
this is so
It's still
exciting.
in the envelope. I know.
That's that new toolkit smell.
Oh, fresh, hot off the press. Wow. Here. Oh, yeah. Here's the. Yeah.
There it
Love
is.
it.
I'll
Very
just say
nice.
the work of a lot of creative, hardworking people went into putting this together. So in the credits, we can thank them all.
Absolutely.
So you can, these are available to order now. We have a contract with the State Department of Enterprise Services or Department of Printing, for those of you who know. And so they print materials for us, and they also run a fulfillment site. So you can create an account at the DES MyPrint fulfillment site and order a packet to be sent directly to your house. Or to the house of somebody that you're helping to take care of. They're also going to be available at local libraries and senior centers. So if you'd like to stop by and pick one up there, that would also be a good option. And of course, for people who, and we know, as Matt said, lots of people are not familiar or comfortable or don't have high-speed internet access, then please do use a library or senior center. That they should have an ample supply of these on hand. So as Matt said, really the focus of this program is about the Medicare open enrollment period. And what I want you to know about the focus of today's program is really that your Medicare entitlement is not changing. So when you enroll in Medicare Part A and Medicare Part B, those are a permanent benefit that you have, that you've earned through the course of your lifetime as a working person. So what we're really talking about during the Medicare open enrollment period is your secondary insurance, whether that comes from the place you used to work or whether you bought that insurance in the commercial market. It's the insurance that pays after Medicare pays first. So as Matt said in his opening, for better or worse, we live in times when almost everything is changing about your Medicare insurance year over year. About 50% of people are enrolled in Medicare Advantage plans, and those are annual contracts between the insurance company and Medicare. So there's always going to be changes. There's typically annual changes as well in insurance offered through private companies like your Medicare Part D insurance plan. And so the first thing that we want you to be aware of is that it's very likely that something is changing. So it's absolutely for your benefit to pay attention during the Medicare open enrollment period. And as Matt said, avoid unwelcome or unpleasant surprises. So some kinds of things that might be changing with your plan would be the provider network, which drugs are included in a formulary, how much you pay when you go to the doctor or hospital or pharmacy, the annual deductibles, the total out-of-pocket costs, and even the monthly premium for your plan. As Matt said, good news this year, the premiums are going to go down a little bit for folks with uniform medical plan, but that's really kind of countercultural. Generally, premiums, including for the Medicare Part B premium, will be going up again next year. So just so that you have ample time to make changes, and of course, as I remind people, these are annual contracts with the Medicare Advantage plans, the Medicare Part D plans, and so you can see plans enter or even exit the market. So if your plan is being discontinued, you would like to know that so that you have a chance to respond and choose a different plan for January 1st. So let me first talk again about what your entitlement means. So when I say entitlement, I mean Medicare Part A and Medicare Part B. Part A is hospital or inpatient benefits, and Part B is medical or outpatient benefits. And you have these benefits for the rest of your life. And then how about additional insurance? Well, let's start why additional insurance. So for two reasons. Number one is Medicare benefits are not comprehensive. For example, there's not coverage for prescription drugs. And number two, when Medicare does cover a service, it still has significant out-of-pocket costs. So I'm talking about things like deductibles, coinsurance, and copays for both Medicare Part A and Medicare Part B. When Matt and I are talking, we use this expression, major medical insurance. So what that means is it doesn't pay for everything, and when it does pay, it doesn't pay 100%. So really the Medicare program, which is celebrating 60 years this year, was designed to keep people from becoming impoverished or having a personal bankruptcy because of their medical bills. So it's not like the modern way that we think about insurance, which is an incentive to go get preventive benefits and paying for everything. So 90% plus people have other insurance besides Medicare, and these are the reasons why. So let's talk about doesn't cover all benefits. For a lot of people, the transition from being a working person to being a person with Medicare feels kind of abrupt because you're expecting it to be the same way. And what you need to know is it doesn't include things like vision, dental, hearing. It doesn't include prescription drug coverage. So it's not as complete or comprehensive as the insurance you had when you were working.
And if you have PEB, that might be different. You might have a plan that is as complete, but for the people who buy on the commercial market, you buy your insurance yourself. It is not as comprehensive generally as your plan that you had when you were employed.
Yeah, that's exactly right. And when I say it doesn't pay 100%, I mean, you could have a substantial amount of money out of your own pocket if you did not have other insurance besides Medicare. This can be tens of thousands of dollars. For instance, a lot of people are aware that Medicare Part B pays 80% of the allowable cost of a doctor's visit. So potentially, without other insurance, you would be paying the other 20%. So these are the reasons why you want other insurance, and these are the things that you're looking for when we talk about comparing plans or paying attention to what's changing for next year.
Guys, I don't want to ever be on Medicare. It's so complicated. I'm just like, why do I lose these things once I'm not employed anymore? Like, you need those things even more when you get older. But now I have to find all these extra plans. Like, oh. But I'm glad we have people like you, Tim, to help us out. Thank you.
And that is such a typical reaction, Alyssa. People really, they're a little bit bitter. They're like, but it's worse. It's not better, and it's more complicated. I have this conversation every year with my mom.
Yeah.
You could make it easier for older people, not harder. And I tell her, Mom, I swear I'm doing the best I can here.
Right. Yeah. It'll get there someday. It'll be better, but yeah. Continue. I just had to vent for a minute.
No, that is a very typical reaction for sure.
Gotcha.
So I'm going to talk about then some most common scenarios that RPEC members are likely to face. And I'm going to do this in a way that kind of conforms to the toolkit that Matt and Alyssa and I have been talking about. So in your toolkit, then, scenarios 4.1 and 4.2 are for people that have a commercial market plan. And then scenario 4.4 is for people who have a retiree group health plan. So let's take a look at each of those in turn then. So for me, a commercial market plan means plans that are available to anyone who has Medicare. They're sold by private insurance companies that contract with Medicare. And this is going to be for people that don't have the option of a retiree group health plan, or they didn't choose that option for whatever reason. And when I say retiree group health plan, what I mean is a plan that's offered by your former employer or union. And it might be for you as the person who worked for the company, or it might be for a dependent of yours, which could be a spouse, for instance, or a covered child on your plan.
And PEB is a retiree group plan, correct?
Yeah, and PEB is probably the preeminent example for folks in RPEC, right? When we think about a retiree group health plan for RPEC members, we're probably talking about PEB, but I think that's also true that lots of people will have coverage from, for instance, the Office of Personnel Management because they worked for the federal government. They might have TRICARE for life because they were a career military person, or they might have worked for a private employer like Weyerhaeuser or Boeing, in addition to their state service. So it's not uncommon because people who work in state service are very dedicated and often long tenured people that they have more than one retiree health plan. So let's talk about then the distinction between changing plans and switching systems. So when you start in Medicare, and then again during the open enrollment period, there are two systems of care for how you can receive both your entitlement, so your Medicare Part A, Part B benefits, and your additional insurance besides Medicare. So in the left-hand panel, I'm talking about original Medicare. You will also hear this referred to as traditional Medicare or fee-for-service Medicare, and other kinds of colloquial expressions. But this is the Medicare program we had until about 40 years ago when we had the advent of Medicare Advantage plans. So you're going to have a red, white, and blue card for your Medicare Part A, Medicare Part B, and then you likely have a Medicare Part D plan and a Medicare supplement plan, or you might have an employer group health plan or a retiree health plan that pays the part of the bill and provides extra benefits beyond Part A, Part B. And then on the right-hand panel, we're talking about Medicare Advantage plans, which are also known as Medicare Part C. You might also hear these referred to as Medicare Plus Choice plans. So essentially, this is a package deal where your Part A and Part B benefits are embedded along with prescription drug coverage and extra benefits of the kind vision, dental, hearing. So we might say original Medicare is sort of a la carte, and Medicare Advantage is sort of like a prefix menu. So with original Medicare, we're talking about a system. Again, this is why it's called sometimes fee-for-service Medicare. You can use any doctor or hospital that accepts Medicare anywhere in the United States. With Medicare Advantage plans, these have a network of providers, including doctors and hospitals. Although Part A and Part B benefits are covered in full, you will pay a different amount than the traditional Medicare deductibles, copays, coinsurances. A typical feature of these plans is prior authorizations or pre-approval for certain services. And so you may need to get approval from your health plan before you engage those. And typically these plans do offer extra benefits like vision, dental, hearing, and sometimes other kinds of supplemental benefits.
Yeah, Tim, I have, as you know, I've really struggled with trying to explain the difference between original Medicare and Medicare Advantage in a fairly short amount of time. And what I've come to is that original Medicare is particularly attractive for people who want to go to any doctor, any hospital. They want to have their knee replaced in Arizona during the winter while it's warm. And they want steady, it'll fluctuate, but fairly steady costs. The premium is higher than Medicare Advantage, but the variance year per year and how much you actually spend beyond your premium is fairly flat because
Mhm.
they pay very quickly after you pay your $250 deductible or whatever it is. They pretty much pay everything.
Mhm.
Medicare Advantage, the premiums are lower. There are other benefits like glasses and hearing, gym membership that are very attractive.
Mhm.
But if you get seriously ill, that's where the expenses can start becoming significantly higher than original Medicare. And your access to specialists might be restricted, or there might be denial of certain treatments that your doctor thinks you need. Um, and so it's almost like original Medicare, you pay more, Medicare Advantage, you pay less, but you're accepting a little more risk, right, Tim?
I think, Matt, I think that's a very apt way of describing it. There are, of course, lots of surveys all the time about Medicare beneficiaries and how well they like their insurance and how well they understand their insurance. And, some recent data that I've seen says people are about equally satisfied, which means about three-quarters of people are very satisfied, whether they're in original Medicare or whether they're in Medicare Advantage. So it's definitely the case that it's not a one size fits all solution, right? So I would say for people who are actively working in state government or retired from state government, if they had Kaiser when they were working and they pick Kaiser when they retire, they're very happy. And Kaiser is kind of the easy example of a Medicare Advantage plan. And people who have that system enjoy it very much, and it works very well for them. And then on the other side, the classic example would be like folks who have uniform medical plan. And when they're working, they want to continue uniform medical plan into retirement, and they continue to like it just as well as when they had it. You don't see very much crossover from one to the other. People generally, I think you described it exactly right. There's kinds of pros and cons to both. In general, original Medicare is going to be more permissive. The costs are going to be more predictable, and they tend to be a little bit higher. But there's a kind of certainty with it, right? And on the other hand, the Medicare Advantage plans, typically your access is going to be managed. They're literally managed care plans. They're generally going to pay less on a kind of month-to-month basis, but you don't know until the end of the year really what your total out-of-pocket spending is going to be. Although it's limited, you don't really know month to month to month what your expenses are going to be. And for some people, like my mother, that makes them fretful. So I would say, because I do a fair amount of counseling about this, of course, we're, very neutral, but I would say, look, if you're a person that you're not going to go to the doctor because you don't want to have a $20 copay, then don't choose a managed care plan. Just pay your premium, and then you feel like, I already paid for this. It's my perfect right to go use it. So I'm really going to be on the side of whichever one promotes you doing the best for your own self in terms of healthcare. That's the one I want you to choose. So don't
Yeah.
let that be a barrier to going and getting care, right?
Excellent. On to the next.
On to the next then. So let's talk about then the first of the three scenarios that we're going to highlight. So this is in, again, relating to our toolkit scenario 4.1. So I'm talking about a person who has their red, white, and blue Part A, Part B insurance. They also have a Medicare supplement plan and a Medicare Part D prescription drug plan. So this is what it looks like in our toolkit. So we're going to say option A would be to change to a different Medicare prescription drug plan. Option B would be to leave original Medicare and choose a Medicare Advantage plan. So I'm going to talk about each of these in turn then. So just as a reminder for people, for context, a Medicare supplement plan you choose because it pays for most, as Matt said, most of the out-of-pocket costs. So the deductibles, the copays, the co-insurances for Medicare Part A, Part B. It does not cover any additional benefits. So most people then choose a Medicare Part D plan to take care of their prescription drugs. So if we think about then, as I said earlier, you might think about this as the a la carte option. So you're going to have your red, white, and blue card. You're going to have an insurance card for your Medicare supplement plan, and you're going to have an insurance card for your Medicare Part D plan. So if I take you back to our toolkit, we've got this kind of fold out, looks like the menu or the placemat you get at the diner down the street. If, like me, you eat at a local diner. And can we see that image, Alyssa? Alyssa, excuse me. There you go.
There we
Yeah, it's
go.
nice for people to see that it's nice and big. This was, we were talking before we came on air about, some of the design decisions that you negotiate with your team. And I was just very strong, you guys. The image literally has to be the same size as the insurance card. And they're like, well, we could save money if it was an 8.5 by 11 compared to by 11/17. And I said, no, it has to be the same size as the insurance card.
You show these examples because many of us, given the somewhat confusing nature of our medical system, is that some of us, we really don't know what we have, right?
Oh, 100%, Matt. That is absolutely the case. And starting with, do I have Medicare? Do I have Medicaid? Is it the same thing? Can I have both? And then it just goes from there, right? So when a very typical thing is a person will come to an appointment and bring many cards, right, from plans they had many years ago that they've held on to, and maybe not even bring the right one. I know, Alyssa, you're going to edit this, but I was at an event recently where I did my short program and offered to stay around and help people. And a gentleman approached me, and he had his insurance card, and he said, "Hey, could you help me? I was told that I have to activate this card so that I could use it." And I said, "Of course." And so I called back to someone that I work with here, and I said, "I just want to validate that this card is the right card for this person." And of course, it wasn't. So he had thought that he had this insurance, but he had actually changed last year, and he didn't remember that. And so we called, because we have access to the Medicare database, we called the company that he was actually enrolled in, updated his address, and got them to send a new card so he could start using that. Now, my personal trepidation about this story, Matt, is that I helped him a couple of weeks ago in August. So for 8 months, he had not been using his insurance because he didn't understand how to get started. And although it seems like that's an extreme example, this happens all the time. That day, the day I did my presentation, there was 30 people in the room, and 5 of them had issues that were comparable to that. I'm 72 years old. I think I should have signed up for Part B when I was 65, but I didn't. Am I going to have a penalty? And this is what we do all day long because, as Alyssa said, the system is so confusing and people feel so fearful that, it's, again, like my friend Leanne would say, there's no dumb questions, right? I would say that if there's 1.6 million Medicare beneficiaries in Washington state, about 9 of them could probably do this by themselves without help. Everybody else needs help. So no one should be, I don't want to be this slow student. Please let go of please let go of not wanting to get help. Everyone needs help. And the volunteers love helping people. It just brings them joy. So please reach out for help. Here's an example for my scenario 4.1 person. You're going to have your red, white, and blue Medicare card, and then you have an insurance card for your supplement and an insurance card for your prescription drugs. So in general, you're going to use your supplement card at doctors and hospitals' offices, and you're going to use your prescription drug card at the pharmacy.
I like Polly C. Holder. I want to meet Polly C. Holder.
Okay, so then just to kind of reiterate then, so this means that you are paying for Medicare Part B. Most people, that's a deduction from their Social Security check. You're paying for your Medicare supplement plan. That's a private insurance company that's regulated by the Office of Insurance Commissioner. And you're paying for your Medicare Part D insurance. These are private companies that are regulated by the federal government. There are very many zero premium plans. And then there are some that have a modest premium as well. But you're basically packing around 3 insurance cards and having a relationship with 3 insurance companies. So during the Medicare open enrollment period, then you can change to a different Medicare Part D plan, or you could leave the original Medicare system and choose a Medicare Advantage plan. So let's talk about each of those in turn then. So changing your Medicare Part D plan is pretty straightforward, especially if you have access to and feel comfortable using the Medicare website. They have a terrific tool that they call the Plan Finder tool. And so you're going to need to keep track of the prescriptions that you're taking, which means the dosage, strength, and frequency, and the pharmacies that you prefer. We're going to tell you that the best choice is to create a private personalized account at the Medicare website. That way you can save your work. If you're already enrolled in a Medicare Part D plan, it will preload all of your current data. So you just have to verify it compared to starting and doing all the data entry. And it just makes it easier for us to help you as well if you've created an account and put your drugs into the system already. We know lots of people are not going to feel comfortable doing that. And so, of course, we will absolutely help you to do that, which means like us managing the technology or managing it together side by side. And again, part of the reason that we chose libraries and senior centers as partners is they generally have high-speed internet access and staff and volunteers who are absolutely willing to help you with the technology part of it.
And I would add, Tim, that how am I going to phrase this? I'm susceptible to what I'd call brand loyalty, where I go, oh, well, I bought a Subaru, the first car I'll look at. If I buy another one, it'll be a Subaru. Medicare Part D plans are not plans to create brand loyalty with, correct? They change their formularies all the time. So probably for people on original Medicare, this is the area that's of the most crucial importance that they check out, because their drug, if you have an expensive drug, the next year it could not be in their formulary, and you don't check that out, and then you go to your pharmacy in January and your price is quadrupled for the drug. So, right? So this original
Yes.
Medicare folks, really, this is huge.
Yeah, no, it's absolutely right, Matt. And with respect to my friends over at Aetna, we had this experience last year where there was a very, very popular Aetna plan. It was $3 a month, and the premium went to $33 a month. And a lot of people just were kind of stumped about that. Like, gosh, I guess it's just going to be $33. And it might absolutely be the case that that was the right decision for you to to stay with Aetna and pay another $30 a month. But what we would say is, well, at least explore, because there's going to be probably 20 other options, right, for Part D plans where you live. It may be that Aetna is the best one, but why don't you just spend 15 minutes and check it out? Because, we want you to get the best value for your money. And going back to, where we started with the toolkit, and Alyssa was kind enough to hold one up, on the screen. The very first thing on the left-hand side of the packet is a big giant envelope. We're going you to shove all your Medicare mail in there. And we're going to say, in this video and in other video presentations, the plan owes you a notice about anything that's changing for next year. So the technical language for this is the annual notice of change. And if you don't get that by the end of September, we absolutely want you to call the company and ask for one, because no one should be surprised about changes. But every year in January, we get lots of people who call and they say, how come no one told me that this was changing? Well, they probably tried very hard to reach out to you, either through the mail or through text or email, but somehow you didn't make a connection. So don't be surprised, like you said at the beginning, Matt, by an unwelcome change. Take it upon yourself. If you don't get that in a timely way, you reach out to the company, call the number on the back of your card and say, hey, Matt and Tim said it's really important for me to know it's changing for next year. I don't want to miss a piece of mail. Could you please send that to me or send it again? They owe that to you. And let me just, so I don't forget to say this, for those of you who, like Matt or Kathleen, that you are enrolled in the HCA PEB plans, that you're going to receive your notice from them through this terrific thing called the For Your Benefit newsletter. So watch for the For Your Benefit newsletter, and if for some reason you don't get it, then reach out to the HCA and ask for one. And you can also find it on their website. But that's how they're going to communicate to you. One of the ways they're going to communicate to you about changes for next year. And of course, as an RPEC member, use their tools. They do a great job on their website keeping track of all the changes that are happening at the HCA and advocating for changes on your behalf at the HCA. Second option then, so we're talking about folks who currently have original Medicare with a Medicare supplement plan and a Medicare Part D plan. You could switch to a Medicare Advantage plan. As Matt said, these are very popular plans, in part because many of them have a zero monthly premium, and they all include extra benefits that are not part of original Medicare. So you're going to use that same plan finder tool at the Medicare website, and you can make sure to include plans that cover prescription drugs and have the extra benefits that you care the most about. And then you can see the plans that are available in the county that you live in. And what I'm going to reinforce for you is to make sure that you can maintain your relationship with your local hospital and the doctors and specialists that you prefer. The plans try very hard to keep their materials current on their website and for the folks who answer the phone to be current. But I'm going to just encourage you to take one more step and reach out directly to your doctor or hospital. And by doctor, I don't mean the person who treats you, I mean the person in the business office. But reach out to them and be explicit about, I'm considering this plan for next year. I need to know that you're part of their network, because we do not want your care to be disrupted.
And this is particularly important, what Tim just said about talk with the business office, not the doctor, because there are some companies that provide Medicare Advantage plans that some providers have had struggles with. And they have just, the provider, the hospital or doctor or other specialist, has decided they are no longer going to bill that plan because it's too much of a hassle for them. So you do want to make sure that your Medicare Advantage plan is accepted by your providers.
Yeah, and I'll just say, the transition from 24 to 25 was a very difficult year for us. And we had a lot of people, especially people in rural areas, that signed up for Medicare Advantage plans and then found that they couldn't use their local hospital. So I'm thinking about like hospitals in places like Davenport, Washington, right outside of Spokane, or Goldendale, Washington, outside of Yakima, where the contracted hospital was the one in Spokane or the one in Yakima, but not the one in Davenport, not the one in Goldendale. And people didn't understand that. And the plans are strictly conforming to the Medicare rules about access. But if you're a person who lives in a place like Goldendale or Davenport, you really want to use your local hospital, especially when the winters get inhospitable. So it really is important to, and I appreciate it can feel effortful, but take that extra step and reach out to your local hospital, reach out to your local doctor, and make sure. Okay, so now we're going to kind of pivot to scenario 4.2. So this is a person who is currently enrolled in a Medicare Advantage plan with prescription drug coverage. And let's talk then about their options during the Medicare open enrollment period. So again, two options, and this is the view that you would have in the toolkit that we provided. So one option is to leave Medicare Advantage plan and switch to original Medicare, in which case you're going to need a Medicare Part D plan to take care of your prescription drug coverage, and you're going to need a Medicare supplement plan to take care of those deductibles, coinsurance, copay. Alternatively, you could stay in the Medicare Advantage system of care and choose a different Medicare Advantage plan that's available in the county that you live in. So let's take a look at each of those in turn then. So again, a reminder about Medicare Advantage plans. They help with the out-of-pocket costs for Medicare Part A and Medicare Part B, the deductibles, copays, and coinsurance, and they include prescription drug coverage and other benefits. So if I think about, again, that sort of menu of cards, you do as a Medicare beneficiary still hold on to your red, white, and blue Medicare insurance card for Part A, Part B, but you're typically not using that when you go to the doctor, the hospital, or the pharmacy. Instead, you're using a card that's issued by your Medicare Advantage plan. And here's what that might look like on our menu. So you do have your red, white, and blue Medicare card, and then you've got a card that's issued by your Medicare Advantage plan. And it's that second plastic card. Typically, your Medicare card's a paper card, and your Medicare Advantage plan is a plastic card. It's that plastic card that you're packing around. You put your Medicare card in a secure place, and you're packing around your Medicare Advantage plan for hospitals, doctors, and pharmacy care. So about payments then, you still do pay the Medicare Part B premium. As Matt and I will say, this can be confusing for people because what they hear is, oh, a Medicare Advantage plan has a zero premium. We mean a zero premium after your Medicare Part B premium. So you continue to pay your Part B premium. For most people, it's deducted from their Social Security check. You pay, if you have a premium, you pay the Medicare Advantage plan directly. It's an annual contract, so they do change year over year. And Medicare Advantage plans are regulated not by the state, but by the federal government. So switching then during the Medicare Advantage plan to a Medicare supplement plan, we also call Medigap plan, and a Medicare Part D plan. Let's take a look at that. So for most people, you're going to need to apply for a Medicare Advantage plan. You're going to need to apply for a Medicare supplement plan and get a letter saying that you've been accepted before you drop your Medicare Advantage plan. So you need to have a letter of acceptance from your Medicare supplement plan before you let go of your Medicare Advantage plan. There are some limited exceptions for people, and an example would be people who have a trial right period, and you can ask us about those exceptions. So the next 3 slides are about Medicare Supplement or Medicare Advantage plans and some resources that our office provides to you and that the volunteers are very comfortable using to help you. So the first is a review about the standard plans and the benefits that they offer in addition to your Medicare coverage. So again, what people like about the Medicare Supplement plans is it pays the part of the bill that Medicare doesn't cover 100%. On the next slide, we're going to talk then about.
My
there
bad.
you go. You're good. So on the next slide, we're going to talk about the Insurance Commissioner's Office also provides a list of the companies that are approved to sell Medicare supplement plans in Washington State, the rates per month for those plans, and how to reach out to the company. So this is just an excerpt of a longer document that we have that will help you navigate about after you decide which is the best plan design for you, which companies offer those plans, and how to get a hold of them.
And Tim, well, I'll do it. I'll give the spiel on comparing rates.
Okay.
They are Medicare supplement plans are standardized by the federal government, right?
Yes.
And so they're all the same. They pay the same. They do the same. But there are wildly different costs for getting exactly the same thing. So you might have brand loyalty on something, which is fine, but personally, I would look for the least expensive plan on that incredible list that the Office of the Insurance Commissioner has compiled for all of us. So just a word to the wise, paying more does not make a difference.
Yeah, thanks, Matt. Every volunteer advisor has their own kind of analogy for explaining this concept that Matt was describing. The one that I like is the half of a gallon of 2% milk. So what I would tell you if Matt and I were talking, I'd say, look, Matt, the same person drives the milk truck around Olympia every morning delivering 2% milk from Wilcox Dairy. And the fact that the Frog Pond Grocery gets a different price than Safeway, than Costco, it's the same milk, same cow, same process, same delivery guy. The fact that it costs a different price at all 3 of those outlets is not about the product. That's a business decision that the company is making about the rate. Maybe it's about the rate that they have to pay the dairy to get the milk, but when I take it home to my wife so she can have 2% milk on her Kellogg's Special K Red Berries, it's the same product. She's indifferent about where it came from. And then the third, I think, kind of helpful product that the Insurance Commissioner's Office produces that we would recommend to you is this guide that we call What You Need to Know About Medicare Supplement or Medigap Plans. I think this is a helpful guide whether you're a person who's considering making a change during open enrollment, or if you're just getting started in Medicare, or if you have a concern about the way that your insurance is being handled. And this is kind of a deep dive about the laws and rules that relate to your consumer protections here in Washington State. And all 3 of those products that Matt and I just put up on the screen, you can find all of those at our website, which is www.insurance.wa.gov. So insurance.wa.gov is a great resource for all kinds of information about Medicare supplement plans and Medicare Advantage plans.
And there's also not only this booklet about the Medigap plans, but you have one for Medicare Advantage plans, I believe. And I would just say that if you're considering moving from Medicare Advantage to original Medicare, if you have I'm going to put quotes around it, a concerning chronic condition or acute, quote unquote, serious illness, they are going to ask underwriting screening questions, a health history, and that may affect your ability to get an original Medicare plan.
Yeah, that's absolutely a key point, Matt. So make sure that you've applied and been accepted for your Medicare supplement plan before you let go of your Medicare Advantage plan. So that sequencing would need to happen between October 15, December 7. So don't enroll in a Medicare Part D plan until you've got your letter of acceptance from your Medicare supplement plan company.
Good point,
Yeah, thanks, Matt. Okay, so we're going to then switch. We're going to pivot a little bit then and say a person, we're still talking about folks who have a commercial market plan. So not people who are in a group plan, but a commercial market plan. They currently have a Medicare Advantage plan, but they want to explore options for alternatives. And as Matt said earlier, you should absolutely do this, because I'll just say, Matt lives in West Seattle. There's probably going to be 50. I know you think I'm kidding, but I'm not. There's probably going to be 50 Medicare Advantage plans next year in King County. And so it's really worth taking a minute to check and see. So hop on that Medicare.gov website and take a look at what's changing for your plan, of course, and then see what other plans are available so you can get the best value for your own self. And I'm going to repeat what I said earlier, that the provider network is the key thing. We don't want to interrupt the relationship that you have with your doctor or hospital or any care that you're getting for a condition that you're being treated for. And don't just rely on the operator or the website. Take a minute and check in with the business office for your doctor or hospital before you make a change. Okay, before I engage with the last scenario for RPEC members, let me just say that at our website, again, insurance.wa.gov, if you put insurance.wa.gov/Medicare OEP, we've got some terrific videos that my beloved volunteers recorded that go into much more detail about those first couple of scenarios we talked about and the options for each one. And we've got some good content as well. So please check out our website after you listen to or watch this podcast for more information about your rights and options and protections for the first two scenarios. So then let's talk about the next scenario. So now I'm going to talk about a person with a retiree group health plan. And as Matt said, typically for RPEC members, this is going to be a person who has insurance from the PEB program, the Public Employees Benefits Board program. And I'm not going to talk in detail about UMP compared to UHC compared to Kaiser or Premera, because the RPEC website has great resources and the HCA has great resources. So I'm going to more just give you kind of a view from 30,000 foot level here.
And I'm going to make a plug. A very important plug for a very important event is that the program manager who is in charge at PEB of the retiree Medicare plans is going to be making a presentation to PEB, to RPEC, all these acronyms, to RPEC in late September. And I think Alyssa knows the dates for that and how to sign up.
It's September 26th, 10 to 11 a.m. with Laura Bryan. And yes, you can register on the RPEC website if you go to calendar and then calendar and events, and you'll see the PEB webinar right there. And just sign up for it. If you need help, just let me know. I can do that.
Laura is the expert who does a fairly deep dive on the differences between the 7 plans. And very quickly, Kaiser is sort of like a Medicare Advantage plan where you have a more limited network and you need referrals to go to a specialist. And there are people who love Kaiser and stay with Kaiser. It works great for them. The rest of the plans, all the other ones, have a more unlimited network, sort of like original Medicare. So that's an important thing for you to understand looking at them. That's the most basic difference between them.
Yeah, and I'll just say Laura is excellent. You'll have a great experience with her. And I'll just also reinforce, Matt earlier acknowledged that a whole host of great advocacy by RPEC, again, Lori, Derek, doing a great job leading the organization. But the HCA PEB will be out in the community with a series of benefits fairs. I should know the number, Matt. I can't remember. I feel like there's 18 of them around the state, including several on the sponsored by the University of Washington and my friend Stephanie from there. But I would, if you're able to, time permits, you can go to one of the PEB benefits fairs and you can see representatives from each of the plans that Matt talked about, as well as the HCA will be there. So it's a great way to make a direct connection. So again, I'm going to show you a picture that I excerpted from our toolkit here. So for folks who have an employer group health plan, first most important point is your open enrollment period may not be the same as the Medicare open enrollment period, because remember the fundamental thing about group plans is that the group makes its own rules. And that includes who's a member of the group, right? Who's allowed to join, and rules about rejoining if you didn't connect on time or if you exited the group. And they are responsible for setting their own open enrollment period. So Matt will tell you, for example, that the PEB open enrollment period is not October 15, December 7. And so it is
October 27th through November 24th.
October 27th. Yep.
That means that they have to receive it on the 24th. It does not mean if you're mailing it in, which is discouraged. Online is much better to make your changes. But if they receive it after the 24th, then problems, unwelcome consequences happen. So it has to arrive on or before the 24th.
Doesn't matter if it's postmarked for the 24th. It's got to actually physically be there. Yeah.
Huge.
Yeah.
It's a big deal. So first of all, pay attention for your group, whether it's PEB or a different group. Make sure you know what the ground rules, rules of engagement are for your group. And then in general, as with all the other scenarios, two kinds of options. So we're going to say option A would be stay with your group, but check out other options in the portfolio. Or option B, for some people, you might leave your group and go to a commercial market plan. So let's take a look at each one of those. So first of all, what does that look like on our menu? It looks like you have your red, white, and blue Medicare card. Remember, Medicare, for all of the scenarios we're talking about, your Medicare entitlement is not changing. You retain your Medicare red, white, and blue card for the rest of your life. So what we're talking about is your second insurance after Medicare. And so your second insurance might be from the place that you worked. So it can be an employer or a union plan. And so you likely have an insurance card issued by them. And so you can see on the screen, then we're talking about the red, white, and blue card from Medicare, and then the card issued by your former employer or union. So the first option, so-called option A, would be stay with your group, but make sure you know what's changing about the plan you have now. And the group might offer other choices. So Matt and I have talked quite a bit in the program with Alyssa about, hey, inside the PEB portfolio, there's a number of choices, some aligned to original Medicare, some are aligned to Medicare Advantage, and you can move freely among those options inside the PEB portfolio on an annual basis. So you might switch from the Uniform Medical Plan to the Premier Plan G this year and decide that it's not the best fit. And next year you might try a Medicare Advantage plan, or you might have a Medicare Advantage plan like United Healthcare and decide that you prefer to try a different Medicare Advantage plan like Kaiser. So you're welcome to move within the plans on an annual basis. The counsel here would be just pay attention to how those changes affect your dependents. If you have dependents on your coverage, especially if your dependent is someone who does not have Medicare coverage. But in general, check out what's changing about your plan, check out other options, and know that one of the really nice things about the group is you can change inside your group on an annual basis.
And then it's important to note that the Medicare Advantage plans within the PEB portfolio are group Medicare Advantage plans and not commercial Medicare Advantage plans. So their benefits are much more generous, I would say. It's safe to say much more than the commercial Medicare Advantage plan. So just because you hear Medicare Advantage in the PEB portfolio, that is not germane as it is in the commercial market.
Yeah, that we can't stress that enough, Matt. That's so important. Yeah, that's so important. So maybe let's talk about your option B then, because this is the so-called grass is greener option, right? So for some people, they're going to think about maybe I'm going to exit my group, right? Maybe, and again, love my mother, Fran, um, and every year I have this conversation with her where she says, I know you said I should stay with my group because that's the best insurance. But I have this friend that I go to water aerobics with, and she has this plan that's much less expensive and it pays for her gym membership. Don't you think I should go there? And I say, well, this is kind of what I do for a living. And I am going to tell you the same thing I told you last year, which is stay with your group. But let me just explain to you why I feel like that's the best thing. So I'm going to repeat what Matt said, first of all, which is that it's apples and pineapples. So the United Healthcare plan, for instance, that is offered through the HCA PEB is a very different insurance plan than the United Healthcare plan that's available in the commercial market. So please be sure you understand what the differences are between the group plan and the commercial market plan. I guess what I would say, sort of for shorthand, is the group is your advocate. So they have negotiated a better rate and better benefits for you than what's available in the commercial market. So the technical term for this is employer group waiver plan. So they are Medicare Advantage plans in the way that they have to conform to the guidelines that the Medicare agency sets, but they're allowed to negotiate with the group administrator to provide a different package of benefits specifically for that group. So again, I'm just going to repeat what Matt said, that generally you have a more permissive provider network. You generally have a better formulary for prescription drugs. You generally pay less out of your pocket for things like co-payments to see doctors and specialists. You're generally going to have a lower out-of-pocket maximum across the entire year than you would in a commercial market plan. So I'm not saying that you should have unlimited loyalty. I'm not saying you should never consider leaving the group. I'm just saying be eyes wide open and do some research and check out the details. I know for a lot of people, the motivation for thinking about leaving is that the group premium is very high, right? They're thinking there's a $0 premium plan in the commercial market, and I'm paying $150 a month for my group product. So 100% get that. You have to do what's best for you in terms of value. I do want to say that there are programs that can help with financial assistance where the state can pay your Part B premium, and that might help you stay attached to your group. Matt, you wanted to say something.
Just that the PEB recipients also get a subsidy from the state of up to $183 a month. That's a lot of money. And so the PEB plans are, you might think they're expensive, but as Tim has said before, you get what you pay for. The PEB plans might cost more, but their benefit package is much better. And the state is subsidizing to the tune of, for the UMP Classic Medicare Part D plan, they're subsidizing the premium you pay to the rate of about $2,200 a year that you don't have to pay.
Yeah, this is a really important point. Again, lots of credit to the advocates, right, through RPEC and other advocacy organizations to, petition the legislature, the governor's office, work with elected officials and advocates. The plans that the HCA PEB offers are subsidized. So the state is contributing half of the cost of your premium, and Laura, of course, will talk about this, but half of the sort of market cost of the plan is being paid by the state on your behalf. And just to be really clear, you earned it, right, by your years of service. But it is important to understand that when you're comparing what's the best value for you. Okay, so I did refer to this document that's called the Evidence of Coverage document. Again, whether you're in a commercial market plan or PEB plan, this is really kind of the source of truth, right? So we're going to talk about covered benefits, out-of-pocket cost sharing, the rules about provider networks, the list of covered drugs. So this is where we talk about like tier 1, tier 2, tier 3, prior authorization, quantity limits, network of pharmacies, and then your annual out-of-pocket costs. So again, I realize that it's effortful, but it's really worth reading past the headlines to do that kind of detailed analysis. And advocates from RPEC or SHIBA volunteers are happy to help you with that review. Okay, and then I did refer a moment ago to the Medicare Savings Program. So could we go ahead one slide there? This is, again, what it looks like in your toolkit. We have a one-pager about the Medicare Savings Program and extra help. So very briefly, what the Medicare Savings Program is for people who have a low monthly income. So we're only concerned about income. Resources don't count. So we're not concerned about savings or other assets to qualify. It's strictly based on income. And if you qualify for support, then you will no longer have to pay the Medicare Part B premium. It's $185 this year. It's going to go up again by the time you hear this program in January. And getting that $185 a month back every month in your Social Security check is a really big deal. And here's where Matt and I are going to say, please help someone else in the community. I know that right now times are very tough, and some of us really can't extend ourselves anymore. But if you have the ability to reach out, even if you don't qualify, you might be able to help someone else to qualify and apply. It's pretty simple application form. In the packet, we have instructions for how you can order one to be shipped to you. Again, if you're not a technology person, a SHIBA volunteer would be happy to help you with the technology part of it. You can generally complete the application in less than 30 minutes online. And then here's where I do my spirited appeal for you to consider being a SHIBA volunteer. There's proven evidence that SHIBA volunteers live longer, happier lives than people that don't volunteer with SHIBA. And Matt is my living proof of it. So a day in the life of a SHIBA volunteer is you're going to help people like you navigate the challenges of their healthcare and insurance. You're going to help them get better access, save money. And this is the thing that I feel like, Matt, that and Alyssa, people don't really appreciate is, the anxiety and fearfulness that people with Medicare have. And so there's such a great sense of relief that they experience from getting help that, is not represented. I could tell you the data and statistics all day long about how many people we helped and what we helped them with and how much money we saved them. And all of those things are very important, but there is a very palpable sense that people have. They'll call and they'll say, I didn't sleep last night worrying about my appointment today. I really hope you can help me. And so for them just to release, that fearfulness and anxiety that they feel, it's just very satisfying to be a volunteer because you know that you made a significant difference in someone's life. So as Matt said, we provide comprehensive training. The volunteers are great. It's a great social experience. And it's very easy to get started, and we'd be happy to help you with that. And I know, Matt, you want to make an appeal for RPEC volunteers. Let's grow Chapter 3.
Okay.
Yeah.
Yeah, Chapter 3 is in Seattle. If you are not an RPEC member, the first of all, joining RPEC, it's like $7.18 a month. For that, you're getting a professional staff, of which Alyssa is one, in Olympia, it's within walking distance of the Capitol. It's very active with lobbying legislators to help protect our retirement security. And there are threats to it. As you know, all you have to do is read the paper. That's what we fight for. And the professional staff is tremendous about that. Then we have the chapter system. You can go to a chapter. There are speakers generally every month. You get to meet people. You get to go out. Many of the chapters have Zoom, so you can watch it if you can't make it. Yeah, my wife is the Zoom master for chapter 3. And then in terms of volunteering, there's all kinds of volunteering that Alyssa would be better at explaining the breadth of that. But the healthcare area, there's the healthcare work group, which I chair, and we delve into the complexities of the healthcare system, particularly how it affects RPEC. So you're welcome to attend that as well. So there's my spiel.
Well, very much appreciate the partnership with RPEC,
Yeah.
and strongly
And
recommend.
we as well, Tim.
Yes, absolutely. Thank you.
You're the
Yeah,
best.
my pleasure. So then quick summary about the things that we kind of covered on our journey today with Alyssa and Matt and I. So we introduced you to our Medicare open enrollment period jumpstart toolkit. And as I said, they're available now to order or visit a local library or senior center and pick one up. We highlighted the 3 scenarios from the workbook that probably apply to most RPEC members. So you're enrolled in a commercial market plan, which would be a Medicare supplement or a Medicare Advantage plan, or you're enrolled in a retiree group plan like the HCA PEB plan. And then we talked about for each of those 2 options for either changing plans or switching from one system of care to the other. So from original Medicare to Medicare Advantage or from Medicare Advantage to original Medicare. We did a quick review about the Medicare Savings Program as an option for people to save money on their Medicare Part B premium, and a pitch for you to advocate as a SHIBA volunteer or an RPEC volunteer. And if you have a little bit of extra reserves, to please reach out to somebody else to help them. There's about 1.6 million Medicare beneficiaries in Washington state. And really our motivation for creating this toolkit was to enable people to do self-service, to help promote a sense of agency for people. You know, most people who have Medicare are going to have it for 20, 30, 40 years. And so anything we can do to just raise the level of literacy and engagement is a good thing. And it's also meant to help promote these peer-to-peer, neighbor-to-neighbor conversations, right? So it's meant to, if you're a person who can help a little bit, it's meant to help you be a better helper to somebody who needs it from you. So thank you if you're able to do that. And I think, Alyssa, that's what I have for today. We have, as I said, lots of, friendly collegial conversation in our little team about the design of the packets. And I have colleagues who are convinced no one is going to use the QR code in the packets because old people don't use technology.
I used it this morning. I used it this morning.
My beloved mother, Fran, who I talked about earlier, she's going to be 86 in October, and she's on her phone. So, and she's using QR code. So we'll see. I mean, it's like a friendly, we're not wagering per se, but I think people will use the QR code. I hope you will use the QR code. If you scan that QR code, it will take you to our dedicated Medicare open enrollment webpage, landing page. So that, again, is insurance.wa.gov/Medicare OEP. And we have a video to accompany each of the scenarios and options that were recorded by our beloved SHIBA volunteers. And so you can kind of do a deeper dive about any of the scenarios that we talked about today, as well as 2 scenarios that relate to people who have Apple Health or Medicaid, in case that is your situation or you're helping someone. So I'll just close by saying again, Matt, tons of affection and respect for you. Love working with you. Alyssa, thanks for the invitation back again. And please call us if we can be helpful in any way.
And I'll close with, don't wait if you're in the commercial market. Don't wait until 3 days before the December 15th deadline and call SHIBA and expect that they're going to be able to help you. They can send you to the videos, which are superb. But if you need that one-on-one help, schedule it right after you get your notice of change document from your insurance company, which will be in about a month and a half or so.
Yeah, thanks for that, Matt. I mean, it's somewhat human nature to wait till the last minute, but I would say whether you're in the commercial market plan or if you're in the PEP plan, like, let's just get this done before Thanksgiving.
Yay. Thanks again to Tim. You've just tremendous. I think you're our #1 RPEC supporter in any capacity across the state. And we just appreciate you so much.
Well, that's very kind, Matt. The feeling is mutual. I love working with you and, obviously Lori and Derek and Alyssa, Claire, folks who are on the board and the committees. You've all made me feel very welcome and appreciated. Thank you.
Aw.
Thank you.